Well, we're going to talk about templates now. As Lance explained, there's different options. One of I think the coolest thing about Practice Partner is you can do it however you want to as a provider. And I know we all have our own little ways of doing things. And even within an office, people can have their own ways of doing things and still make it work. So I guess our goals, our goals for documentation is, most importantly, we want to provide quality care. Secondly, we wanted to do it rapidly and accurately. And I think the biggest selling point for me is I went from residency, where I was staying an hour after clinic to dictate and finish the notes, and maybe even get in early the next day to finish up what I couldn't do that night because I had to get home for a son's soccer game or whatever, to now documenting real time with the patient in the room, capturing more accurate data as opposed to thinking, geez, John Smith was left ear, or, what was it? And so now I'm documenting real time, and I was leaving at the end of the day, and I didn't take any work home with me. And I'm like, wow, this is nice. So that's, to me, the value, the power of the EMR is it saves me time. I can spend time with my family instead of with my charts at the end of the day. We wanted to be able to get paid for what we were doing. I think a lot of us a lot of physicians undercode for fear of not coding accurately. And one of the things of this EMR is that you capture all those data points in a way where you can justify that 99214 as to say, I guess a 99213, I didn't want to, if you don't dictate a nice note. And that was one of the power things of this as well. We didn't want to use Dragon. I couldn't use a headset and the phone and feel comfortable talking to a patient and documenting. That would have been kind of geeky for me, I think. And I didn't want to dictate at the end of the day. And so that's why we wanted to use templates.